This segment is sponsored by Boston Scientific. Hey everybody, we're talking today about a medical condition called BPH, or benign prostatic hyperplasia, which can affect men as they age, and it's pretty common. Here to educate us on ways to help this morning is Dr. Robin Roberts from Urology Austin. Dr. Roberts, good morning.
Good morning. Thanks for having me.
Thank you so much for being here. Let's talk about BPH. I mean, it's not a term I think a lot of us know unless you've officially been diagnosed with it, but I hear it is pretty common. What's the cause of it, and how is it often treated?
So you're exactly right. BPH is a very common condition that I see in clinic. About a third of my patients come in with this complaint. What it is a prostate that's enlarged and it's obstructing the flow of urine from the bladder through the urethra.
Now, how is that normally treated? I know you and I talked off camera about pills tend to come up, don't they?
Yeah, so the most common forms of treatment are medications. Oftentimes, men come in to see me, they're already on 2 medications for this condition, and my goal as a provider is to really get them off medications and get them functioning normally.
And so Rezūm water vapor therapy comes into that, which I hear is minimally invasive. Let's talk about what it is.
Yeah, absolutely. So Rezūm water vapor therapy can be done in the clinic. You don't need general anesthesia, you don't need to go to the operating room. We do this in clinic and keep you nice and comfortable with some pain medications during the procedure. It's a great therapy to reduce the prostate volume, thereby reducing the symptoms of BPH.
And when I hear water vapor, I'm thinking, is that actually the tool that we're using to help somebody's body?
Yeah, it's very natural. It's steam delivered to the excess prostate tissue, which allows that tract to open up so you can void more freely.
Wow. And how quick is a turnaround? When I hear minimally invasive, I think probably very little downtime, right?
That's right. So you come into the clinic, you go home, you recover. Recovery is about a week, and most people see symptom improvement within 3 weeks.
Wow, that's pretty impressive. Yeah, let's talk about who might be somebody that could benefit from Rezūm water vapor therapy and why it's kind of an important BPH treatment option.
Yeah, absolutely. So the men that I see in my clinic, like I said, often come in already on medications, and they don't necessarily like the side effects of those medications. Some of those medications can cause fatigue and dizziness. As many as 15% of men who are on some of those medications have low blood pressure because of that. So men who are dissatisfied with the way their medications are making them feel or dissatisfied with the way they're voiding are great candidates for this procedure. It's a very important procedure because for a long time we only had medications and then more invasive surgical procedures for this condition. And with Rezūm, we can really offer men a minimally invasive procedure that's easy to recover from without some of the side effects of having an invasive procedure.
Yeah, I think that's good news for a lot of people who have this condition. But if we can for just a minute, let's touch on folks who may not know they have it. What are the sort of symptoms that somebody would notice with BPH, which might mean they need to come in and see you?
Absolutely. So men will often come in and they'll say, you know, doc, my stream is very weak. I have this urgency to get up and go to the bathroom. I'm waking up several times at night. I stop and start. I'm standing at the toilet and my stream just won't start. Those are often very common symptoms that I hear in clinic.
And it might mean a BPH diagnosis, but of course, we always need to check with you first.
Absolutely.
Right. Okay, and just before we let you go, you told me off camera about the reason you became a surgeon, which I thought was really motivational. It's super interesting to hear, and it involves stuff like Rezūm water vapor therapy.
Absolutely. So one thing I love about surgery is we really want a functional outcome. So if someone comes in and they have a functional problem, surgery can really help that. Medications will often mask symptoms, but not actually treat the problem. And in this condition, the problem is excess prostate tissue that's compressing the urethra. So if we can fix that and get people off medications, that's just very rewarding to me. I often have people walk in and they're on 7 medications, and if I can get them off of 2 of them, then I'm really happy.
Yeah, it's a win for sure. And this is kind of a touchy subject, but I do want to make sure we talk just a little bit about preserving sexual function, because I know that that's something that keeps men from ever going to the doctor. They're a little bit worried.
Absolutely. So this is a very personal area that we treat, and men come in and they're concerned about their sexual function and preserving that for as long as possible. One thing I love about Rezūm is that it does not compromise a man's sexual function. So they can have this minimally invasive procedure, treat their BPH symptoms, and maintain their sexual function.
Well, cutting edge medical advice. I love to hear it. Dr. Roberts, thank you so much for your time.
Thank you.
Urology Austin has more than 45 providers at 18 locations in our area. Find a provider near you at urologyaustin.com and learn more about Rezūm by visiting rezūm.com. This segment is sponsored by Boston Scientific.